If you've ever found yourself wondering, why isn't she getting aroused? Am I doing something wrong? You're not alone. Foreplay is one of the most misunderstood parts of intimacy. For many men, it feels like a checklist. Kiss a little, touch a little, maybe try oral sex, and hope it works. But here's the truth. If foreplay feels mechanical, pressured, or like a chore, it won't work. What if I told you there's one technique that never fails when it's done correctly? A technique that doesn't just get her body ready, but actually makes her feel deeply safe, desired, and fully alive in your arms? Stick with me, because today I'm going to reveal the most effective form of foreplay I've ever taught in my 6 years as a urologist and men's health specialist. But before we dive in, do me a quick favor. Hit that like button if you care about building stronger intimacy. Subscribe if you want more real, science-backed men's health advice. And tell me in the comments, where are you watching from? I love seeing how far this community reaches. Now, let's clear up a myth that leaves so many men confused and women frustrated. Myth: foreplay equals touching her genitals. Truth: if she's not aroused yet, that kind of touch often feels flat, pressured, or even uncomfortable. Her body isn't ready, the nerves aren't activated, the blood flow isn't there, biologically the tissue is still offline. Foreplay isn't about jumping to the main event. It's about waking up her whole nervous system. Think of it like slowly lighting a fire. If you throw gasoline on cold wood, nothing happens. But if you warm it gently, with air, spark, and patience, it catches. And once it catches, her desire doesn't just grow, it often snowballs. She feels craved, cherished, and connected to you in a way that makes sex feel deeper, longer, and far more satisfying for both of you. If you're new here, I'm Dr. Lily Morgan. I've been a practicing urologist and men's health specialist for 6 years. I work with men who want to feel confident again in their bodies, not just in terms of erections, but in terms of connection, pleasure, and performance. And I'll tell you this, it's never just about mechanics. It's not about lasting longer or learning some trick. True intimacy, the kind that makes your partner light up and lean into you, is about understanding her body and her mind. So today, I'm going to walk you through the 4 biggest foreplay mistakes men make and why they kill desire. The one technique that works on nearly every woman when you do it right. And finally, how to make it flexible so it never feels routine. Sound good? Let's get into it. Mistake number 1, going straight to oral sex. A lot of men think, well, if I go down on her, she'll love it. But here's the problem. If she's not aroused yet, the nerves in her genitals aren't firing properly. Biologically, her blood flow hasn't increased. The clitoris and vaginal tissues aren't engorged. That means stimulation feels dull or even uncomfortable. Emotionally, she feels pressured, like she's supposed to respond even if her body isn't there yet. Practically, she might pull away or fake it, which leads you to wonder if you're doing it wrong. Yes, oral sex can be amazing, but it works best after arousal has already started. Think of it as a bridge to penetration, not the warm-up. Mistake number 2, sensual touching that's too soft or too rough. Here's what I see all the time. Men either graze so lightly it feels ticklish, or grab so hard it feels invasive. Neither creates true arousal. Biologically, women's nerve endings respond best to consistent, confident pressure. Emotionally, she wants to feel held, not pawed at or barely skimmed. Practically, too soft equals boring. Too hard equals overwhelming. This is why many women say, he just doesn't touch me the right way. It's not that you're broken, it's that no one ever taught you the right calibration. Mistake number 3, massage as the main course. Massage is wonderful for relaxation, but it's not the same as arousal. Biologically, massage signals the nervous system to calm down. It reduces stress, but it doesn't activate sexual arousal pathways. Emotionally, she might enjoy it, but she's drifting off, not waking up. Practically, if you stay in massage mode too long, she'll be comfortable, but not turned on. Massage can be part of the vibe, but it's not the engine that drives her desire. Mistake number 4, mental stimulation alone. Talking dirty, teasing, saying the right things, these can help, but they're inconsistent. Biologically, arousal isn't just in her head, it happens when her body is fully awakened. Emotionally, words can spark the imagination, but if her body doesn't feel it, she's left frustrated. Practically, if you lean too heavily on mental stimulation, you're asking her to think her way into arousal. That rarely works. So what works? I call it full body to body flow. Instead of focusing on one spot, you use your entire body. Chest, stomach, arms, hands, mouth, even your breath, to slowly, sensually flow over her. You're not just touching, you're enveloping, full contact, gliding over her curves, breathing her in, savoring her like it's the first time. Your hands are always active. Your mouth is always engaged, but nothing is robotic. It's a dance of closeness, rhythm, and sensation. Why does this work so well? Biologically, you're activating a massive surface area of nerve endings all at once. Her brain gets flooded with signals of safety, pleasure, and connection. Emotionally, she doesn't just feel aroused, she feels desired, adored, held. Practically, instead of awkward starts and stops, you create a rhythm she can sink into. This technique flips a switch in her nervous system. Suddenly, she's not thinking about sex, she's feeling it. And when her body feels safe, arousal snowballs. Even women who normally take a long time to warm up, or women who've struggled with desire in the past, can go from neutral to deeply aroused in minutes when this is done right. Now, here's the beautiful part. You don't need to be perfect. You don't need to perform. You just need to stay present. Every woman responds a little differently. Some want deep, passionate flow. They want to feel taken. Others need it slow, tender, and emotional. Some need both, depending on the day. The technique is the same, the settings change. Think of it like music. The melody is the same, but you can play it soft or loud, slow or fast, romantic or fiery. That's what keeps it alive. And remember, if you do the exact same thing every time, it will get boring. Variety is what keeps desire alive. When you master this kind of foreplay, something amazing happens. She doesn't just get aroused faster, she feels deeply connected to you, and sex stops being a routine. It becomes something she craves. This isn't about tricks. It's about awakening her body, her heart, and her trust in you, all at once. And here's the best part. You don't need to be 20 years old or some Hollywood star. You just need presence, patience, and the willingness to learn. Because intimacy doesn't decline with age. In fact, for many couples, it gets better, deeper, richer, and more satisfying. So take this with you. Age is not the end of vitality. Small changes in how you approach her body can bring back freedom, confidence, and connection you may have thought was gone. If you found this helpful, hit subscribe, share this video with a friend who could use it, and let me know in the comments which of these mistakes you've seen in your own relationship. I'm Dr. Lily Morgan, and I'll see you in the next video.